she was not going to let anything stop her.
No.
So,
But I think you knew that about me.
Welcome to another episode of the Basic Adam podcast. We have more special guests for you today who are here to share their healthcare journey as well as their medical experiences or expertise. As a reminder, our expressed views and opinions within this podcast are our own and are not a reflection of the views or opinions of our respective work organizations. Also, this podcast and the information within are not intended to be used for medical advice. If you or a loved one have a medical issue, please contact your healthcare provider for further information. Lastly, if you're experiencing an emergency medical condition, please call 911 or your respective emergency medical services number for immediate medical attention. And now, on to our podcast. So I'd like to welcome you all here to a discussion we're going to have with two very important people in my life, my Aunt Stephanie and my Uncle Chris. They've meant a lot to me over my lifetime. There's been a lot of really good memories that we've built together. Some of this conversation will be personal and emotional, and so if we have to pause for breaks during it, that's okay. It's a very difficult thing to discuss some of the things we're going to talk about, but I'm here with them to talk about something really significant that happened in my Aunt Stephanie's life and my Uncle Chris's life about 13 years ago now at this point. I have very fond memories of a lot of things at their home, like Christmas together, my Uncle Chris splitting his head open on our trampoline as a young kid, trying to show off, and a whole slew of other memories. And I know some of those memories we may not have been able to have if it wasn't for good medical care and, in my personal opinion, something miraculous that no matter what you believe in, there was some divine intervention that happened. And so every year worldwide, there's about 20 million intensive care unit or ICU admissions around the world. About 4 million of those occur in the United States. And being admitted to the ICU is a very serious medical issue and serious problem, meaning that a patient is very ill. And the mortality rates worldwide vary anywhere from 9% to 61%, and in the United States, 8% to 20%. So I think it's fair to say that in the United States and worldwide, that not only do ICU admissions and hospitalizations have a dramatic impact, both economically from a healthcare cost perspective and the patient's financial burdens moving forward as they recover, but also just the emotional impact and the mental impact on families and the patients as they are admitted to and recovering from the ICU should they recover. And so that's what I wanted to talk about here with you guys today is, Aunt Stephanie, you went through quite a crazy journey 13 years ago. That was one of my first experiences of getting in the medical field and specifically in an intensive care unit setting and critical care setting. And so first, I just want to allow you guys some time to introduce yourself and let everybody know a little bit about you. So, Aunt Stephanie, like, what do you do for a living right now? Where did you grow up? What was like for you growing up?
For growing up, I was born and raised in Cleveland, it's a suburb of Cleveland, and my dad was a paramedic when I grew up. So I kind of had some idea, some medical knowledge just from the crazy stories he would tell us as kids at the dinner table. Some things would gross people out. But I'm like, oh, I didn't know that it was gross until I went to college. I'm like, oh, that's gross. That's not what you talk about at the table. Because it was normal for us. And then currently I work at Mayfield Middle School, and I'm a Spanish teacher there. And how about you?
Awesome. Yeah, Uncle Chris, where do you work? What do you do? And what was life like for you growing up?
so I was born in Brownsville, Pennsylvania, but my family moved to Ohio when I was about 5. I'm from a big family. I had 8 kids in our family. I never had any experience with any medical things. I mean, there was nothing that, even though there were 8 of us, I don't remember anybody ever going to the hospital or anything. Personally, I met Stephanie Um, we got married. I work for a company that makes automotive wiring, um, and I'm a senior systems analyst for that company. I work on our global engineering system. Um, Life growing up was pretty easy for me. Like I said, there was no real traumatic things that happened in my life or with any of my siblings or my parents until later on when I was an adult.
Yeah.
So,
Well, it's definitely a difficult time for sure, and I'm sure you didn't expect what was coming in 2012. So, why don't you start, Aunt Stephanie? Just curious, the few days maybe leading up to going to the hospital. What was that like? What were you experiencing? Do you remember much about it?
Some things I remember, some things I don't. I remember it was Christmas time, and we had 3 young kids at the time.
Mhm.
I think Taylor was just in high school.
yeah.
I think he was just in high school. So Christy was 6. That's our youngest, and then Trent was, well, he'd be in 7th grade then. So Christy was in 1st grade. Trent was in 7th grade. Taylor was in high school, 9th grade. And so the night before, I was on the ground wrapping Christmas gifts, on the floor trying to wrap some of their Christmas gifts. And I noticed when I got done that I had some like lower back pain. I didn't think anything of it. I was like this, trying to wrap gifts for, I don't know, what, 2, 3 hours at least,
hmm
fighting with the cats because they wanted to mess with the wrapping paper. So I didn't think anything of it. I said, I'm going to go to bed now. I got this many gifts done. And that was, I went to bed. And that I was actually helping out at our church that year with the confirmation class. And I was supposed to teach the lesson the next day. And I said, I can't go. I just don't feel well. I don't know what's going on, but I just don't feel well. Would you mind taking the lesson to Dave and, have him, go over it with the
Yeah.
kids? And he goes, yeah, sure. No, I don't care. So, and then I guess the Monday, I remember just being like really sleepy, like really tired. And I was kind of bummed out that I was sick because I'm like, we had like literally one more week of school before winter break. I'm like, figures I would get sick the last week before winter break.
Mhm.
So my goal at that point was just to get to school by Wednesday, and that didn't happen. But Tuesday I started to feel better and started to eat a little bit, and
Well,
then
she did go to the doctor. I mean,
oh,
when
that's
she
right, I
said she didn't
forgot I
feel
did.
good, good.
I forgot. Go ahead.
So Monday she was really sick. I mean, like the flu kind of
Yeah,
thing.
Mm-hmm.
kind
And
of chalked it up to flu-like
so
illness around
she
that
wasn't
time of
really
year.
eating. So we got an appointment. We took her to the doctor, and the doctor basically, examined her. And I mean, I had to literally help her into the
Mm-hmm.
doctor's office. That's how kind of weak she was at
Right.
that point. But we didn't think anything about it because we never had any experience. So we get into the doctor's office. Doctor examines her. Um, and she's looking, but she didn't really say she was going to do anything. And then you had mentioned that you had a pain. She had a pain right here, but she blew it off. Would you tell the
I
doctor?
thought it was gas.
And
Like it's just gas.
and she goes, "No, I'm fine." Because she goes, "Well, I'll send you to the emergency room." And she's, "No, I'll be fine." So
Well, then I was also worried to mom mind. I'm like, no, the kids are gonna get off the bus,
yeah,
so
Yeah.
we got to be home to get the kids off the bus.
Yeah.
So normally they would go to my parents' house when they would get off the bus, but like they knew I was home that day, so I'm like, yeah, just come home after school because I did not think I was that sick.
Mhm.
I
Yep.
just didn't
Yeah.
think I was that sick.
So that was Tuesday you went to the doctor.
Monday.
Monday.
It was
Monday.
So
Okay.
it started like
Mhm.
Saturday night. Then Sunday she didn't go to
Mhm.
the church. Then Monday she did not
And
go to
went to
school.
the
We went to the
doctor.
doctor. She really wasn't eating that Monday. Like she was like just
I think I had
super very
Gatorade or
little.
something.
Yeah,
I
she
remember
was
drinking a
very little.
Gatorade.
Tuesday she kind of turned around a little bit, was eating more. I
Mhm.
go, that's good. I
Yeah.
felt good
Yeah.
about it. Well, Tuesday evening, late Tuesday, it had to be sometime like 12:30, maybe it was already Wednesday morning. She started throwing up. Well, she eventually threw up blood, and I said, "Okay, we're going to the hospital."
And I don't remember that at all.
You
No,
don't remember
I
going to
don't
the
remember that at all.
hospital at all.
no.
So you
No.
don't remember much about what happened in the ER at the hospital.
No, not really. I remember
Okay.
getting there and kind of walking in, and they put me in a wheelchair right away, and then they took my blood pressure,
It was
and I was like this, kind of like half asleep. I had my hand on the armrest of the wheelchair, and I was trying to
Mhm.
sleep. I just was tired in my mind. I'm just tired. I don't know why I'm this tired. I'm just tired. And so the triage nurse, took my blood pressure, and then she went over to a little phone that was on the wall, and she said, "I need a bed." stat. Well, just from my dad, telling us, all his stories, I knew what stat meant. And I'm like, oh, that's not good. They'll tell me what's going on. I'm going back to sleep. So, and then I remember them asking me if they could do a chest X-ray, and I said, well, yeah, but I don't remember getting that done either. And I mean, I don't.
And what do you remember from the ER when you first got there?
So
and
what
it
happened was I got her in, and I had to go park the car. So all the stuff that she's telling you happened while I was parking the car. And I come in, I go, where's my wife? And they said, well, we took her back to her room. And they told me that her blood pressure was real low. Like it was some crazy number. And I think I got the amount right. I mean, this is like 12 years ago, but I think it's like 50 over 20. I mean, it was like extremely low.
Like to the point where you were like, oh.
Yeah.
Like,
I would notice that
like
there was a
50
problem.
over, 50 over 25.
Or something like that.
Yeah.
And so when I got her, or when I got to the room, okay, she was awake at that time. And the doctor that had the emergency room doctor, he actually had a good personality. He comes in, what's he say to you?
You got a big old pneumonia.
Yeah, and he had the X-ray, and he was showing her.
Oh, okay.
Yeah.
So he goes, he came to my bed around like where I could see him because I don't even know I was laid down flat, and he goes, what do you want me to do? I said, well, I mean, you're gonna have to call Julie, tell her I'm probably not gonna be in for the rest of the week because this is Wednesday already, and they told me that they're gonna admit me. So he's like, okay.
So I went, called her bosses, and said, hey, she's gonna be out. Well, by the time I got back, they had already put her in a room. She was already intubated.
Yeah.
I mean,
it was that fast.
She was on a million machines. I'd never seen so many. And then she was not conscious probably for the next 6 days. Somewhere around maybe Christmas time, she woke up. Maybe day after Christmas, I can't remember.
No, it was a couple days before.
But the doctor, he came out and he was saying, well, she had influenza A. She went septic, and they started her on antibiotics and everything. And I did learn a lot because I found out that when your blood oxygen levels are lower and your blood becomes acidic, the antibiotics don't work as well. And I didn't know what was going on.
So let me backtrack just a little bit. So from the ER, how long would you say she was actually physically in the emergency room? Like 30 minutes, an hour?
No,
not
like,
even.
Like minutes.
Yeah.
That's how sick she was. I
Wow.
mean, yeah, I parked the car. If you know me, Chris, I walk fast. I do everything fast.
He's very, very fast. For everyone listening, he is way faster than me.
So I parked the car. I got in there. She was already in the room. So it was probably
10 minutes.
No, not even that. I mean, I parked in that first row of cars.
Oh, did you?
Yeah. So it couldn't have been more than 5 minutes, and she was already out and into on her way to a room.
On the way to an ICU room.
Well, it was
room
I don't know what you call them, the emergency room.
Yeah.
Yeah.
So in the emergency room, from the emergency room until she got up into their ICU, how long did that take?
That probably took. We waited a little bit. They brought in the X-ray. What would you think we were waiting in that room?
I was out. I don't know.
Okay, so
yeah, I don't remember.
So that kind of you got to fill me in.
Yeah. I'm thinking. I went and I called. That conversation or that call did not take that long. Because it was basically trying to call her off. Couldn't have took more than 5 minutes, and within maybe 5 to 10 minutes, I think she was out of that emergency room up into the other room
and intubated.
Yeah,
and so she was upstairs. What it sounds like within it, 30 minutes to the maximum an hour.
Yeah, it was. Yeah,
into
it was
the
quick.
ICU.
It was
so
quick.
I think this is kind of what I tell any of my trainees, whether it's nurse practitioners, PAs, or residents who I train in the emergency room, is I always ask this question of them. And it was taught to me by one of my emergency medicine mentors when I was training, is they always ask me, who's the sickest patient in the emergency room?
Yeah.
And the sickest patient in the emergency room is the patient in the waiting room that you don't know is sick. that you have to get to. And I think you kind of highlight that because you walked in, and this
Right.
is why we have our triage system, which is super important. But even sometimes I've seen people who are probably very sick, maybe not as sick as you were at the time because you
Right.
were very sick, but very sick who we don't know are out in the emergency room. And our job as emergency physicians is to get through people who have medical problems but may not be critically sick to get to these critically sick patients and get them up to the ICU as fast as possible because we know that the longer you are in the emergency room, even though they provide pretty good care, it's a different level when you get to
Mm-hmm.
the ICU, which I'm sure you can definitely speak of. And so that sounds like everything happened very quick.
Oh yeah.
Yeah.
Especially on that was Tuesday,
Yeah.
right?
I
Oh,
think
That was
it's
Wednesday
early,
morning,
or
early
when early
early
Wednesday
Wednesday
morning.
like I'm talking 1 o'clock in the morning, something
Yeah,
like
and
that.
Mm-hmm.
so I remember getting a phone call from my mom at the time telling me that you were in the hospital. I was probably at about 5 or 6 a.m. because I'm a pretty big gym rat and I've been getting up at 4 or 5 in the morning for the last 15 years since training. And so she knew to call me at the time because I would be up, and she told me how sick you were. And I was a second year medical
Mm-hmm.
student at the time, hadn't gone on clinical rotations or anything yet. So I knew it was something serious just from my basic kind of background, but that's how I remember finding out. And then I know she was in Hillcrest for, was it a day or two, Uncle Chris, or about 24 hours?
No, about 2
2
days.
days. And so
Yeah.
what happened while she was
So
at the hospital, at the first
so
hospital?
at the first hospital, they I don't think they knew how to talk to me. They were using terms that I was not aware of. Like they would tell, like one of the things they told me that was happening to her was about her the antibiotics and her acidic blood. Her oxygen levels were low. The other thing they told me is she developed, and I can't remember what it is now, but you'll know the term. It's when your lungs start to get kind of hard.
ARDS.
Yeah, she was in that,
Yeah.
and they would use a term saying, well, all we can do is provide support, because they said, well, ARDS is like an inflammatory. I said, oh, you can give her like anti-inflammatories. They go, no. So they did, they did answer my questions, which was good. One of the other things I knew, they gave her some type of treatment. It started with a K. It was some special, like blood platelets or something like that.
Okay.
And they tried to do things as quick as possible, but to me, it always seemed like an eternity to get the stuff to her. Because where is
Do you
it?
remember the name Kcentra?
That might be it. It was a very expensive
that was it.
medicine or something.
Yes. At
Yeah.
that time, it probably would have been super expensive because it
Yep.
was probably just, I think, just coming out of or being on patent and
Oh,
just
wow.
came out not
Yeah.
too long ago.
And so they did that. Like I said, she was not conscious. I would be in the room. The machines would be beeping. The one that's measuring her blood oxygen, it would go up, go down, beep, driving me crazy. The nurse that was there attending, they would ask me, who came with you? I was her husband. I'm like, what a weird question. But I didn't comprehend how sick she was. I'm going, I don't know what they're talking about. So eventually what happened, it was Thursday, and the nurse said, well, is there anybody that you can call that can come and be with you? Because she's really sick. So I eventually asked the doctor, I said, well, what are we talking about here?
So is this the first time someone expressed to you in kind of layman's terms, like your wife is incredibly ill to the point where you need to be extremely worried?
Well,
Even though you were worried, because
yeah,
anytime someone's sick and on the
when
ventilator, you're worried.
I actually
but
had to ask the doctor, because he kept saying, well, this, that, and we're going to support her through this. And I said, well, doctor, I said, how sick is she and what are her chances of recovery? And he goes, it's 50-50. That's when I was like,
Mhm. This is scary.
yeah. But then that's when they said, well, is there somebody? So we did, her dad came up.
Yeah.
Um,
'Cause my mom was still
your,
working.
I think your
My
mom
mom
came
did.
up.
My mom did.
'Cause my mom was still working, I
Yeah,
believe.
my mom definitely came up. I
Well,
do.
no, your mom had a cold.
Oh,
That's
she
why.
did?
That's why
Oh,
her
okay.
mom would not come, because she
She had a
didn't want to
Yeah.
cause bigger problems.
Yeah.
So the nurse said, well, I said, well, we got 3 kids. He said, well, you might want to bring the older one because Taylor was just starting high school. So I brought Taylor up. He went in to see his mom. He almost passed out because when I say a lot of things hooked up to her, they were a ton.
Yeah.
And not sure where you want to go with the next question, but what they basically said, hey, we've done everything we can do here. So we were trying to get her moved to a larger medical facility that had more resources.
Tertiary and quaternary care center that can do other things that their smaller hospital wasn't capable of.
Well, they even said different machines.
Yep.
I don't remember that. I was just told that.
Yeah. But the problem was where we wanted to send her, they had no bed. They also, the weather was kind of bad because it was December. They said, she's so sick that we don't know if we can land transport her. And the wind was blowing and stuff.
I remember.
And they said, we don't know if we can life flight her because the weather's too bad.
Yeah. It was either, I can't remember because of the time of year it was, if they were predicting like a bad snowstorm.
Yeah.
Because obviously we live in Ohio and that is a whole
Oh, yeah.
possibility. Or if it was like that freezing rain type like weather that we sometimes get in the winter. But it was, I remember
I know the wind
being
was
told it was
high.
very bad and the wind was very high at the time.
Yep.
So then what happened?
So I went home. The nurse said, hey, there's nothing else you can do. Go home. We'll give you a call if anything happens. So eventually went to sleep. Probably early Friday morning, like it was still dark out. Probably 3 in the morning, they called me. And they were able to life flight her to Cleveland or to the hospital. A bed opened up, the weather changed, and then the nurse said, okay, there's nothing you really can do. She gave me the floor, the unit. She said, tomorrow, just, you can go find your wife at that. And that's how she ended up at the larger complex.
Yeah.
So
I remember hearing the story from my mom and my mom telling me like, oh, the hospital said that we have a window to transport her. And so it was something, in my opinion, a little more supernatural going on at that time. Because I think without that, there's a possibility that things may not have turned out as well as they did.
Yep.
So pretty incredible story from the beginning. And I know it's still not over. To kind of fill you guys in on some of the terminology, because I know you learned a lot during this, Uncle Chris and Aunt Stephanie. I know looking back on it, you've learned a lot. But ARDS is, it's one of the most serious medical kind of conditions you can have. And you can get it not only from pneumonia, but other things like pancreatitis can give you it. Trauma, if you're in a car accident, really, really bad car accident with multiple injuries, you can get it. Any type of infection, urinary tract infection, gallbladder infection, pneumonia. The most common is pneumonia gives you it. And what it is your body has what's called a hyperactive or an exaggerated immune response, which attacks the lungs essentially. It causes intense inflammation in small areas of the lungs outside of just where the primary infection is. And so what happens is they were telling you, your lungs get stiffer and they make it harder to get oxygen into your blood. And as we all know, oxygen is super important in life because it feeds all the rest of your organs, your kidneys, your brain, your heart, your muscles, everything. And so our goal, why they use the term support so often, is a lot of the times in the ICU, we don't cure people of their illnesses. There's a couple illnesses we do cure that we have like antidotes for. But a lot of the times what we're doing is we're giving the body time and support to recover. And so we have certain strategies like putting patients on a ventilator to take control of their lung mechanics and to reduce the amount of pressure their lungs see to prevent any other further damage and to protect the good parts of your lungs that are still kicking, so to speak. Starting things like dialysis, which a lot of the times in these situations are temporary, to give your kidneys time to recover, because your kidneys are the most sensitive organ to well, one of the most sensitive organs to low blood pressure, and they become damaged pretty quickly, but they can also recover over time. And so we use all those different things. Antibiotics are a form of support. So some antibiotics kill bacteria directly. Some antibiotics stop bacteria from growing rapidly to give your immune system time to catch up, basically. And so a lot of what we do in the ICU setting is getting your organs through that initial injury period and allow them to recover themselves.
One of the things that I forgot to mention, and this goes into her story, was because her blood pressure was so low, they put her on pressors, which restricted the blood flow to her extremities, which was another part of the story.
Yeah. So I know then she got flown to the tertiary and quaternary care center, and she was on a lot of pressors, probably multiple of them. So I'll ask two questions. When was the idea of dialysis introduced? Was it at the quaternary tertiary care center, or was it at the smaller hospital?
I think she might have been on dialysis at the smaller hospital.
Okay. Was it the continuous dialysis at the smaller hospital?
Yes.
Okay.
Yes.
Like it was a machine. It may have been green.
Yeah.
Sometimes it was they're green.
She went
looking.
through two types, and I'm pretty sure they put her on dialysis at the smaller hospital, but they continued it at the larger hospital. But then they also had a more intense machine at the other hospital that they had somebody sitting there watching it while they administered it. And I don't know how long it ran, an hour, 2 hours, whatever. But it seemed like it was more critical of what they were doing, and I don't remember what that was called, but it used to stress me out because you had a nurse there actually watching them, watching her blood pressure and all the stuff on the machine, or on the other one, it just ran.
Yeah.
So
when she got transported to the second larger hospital, what's the first thing you remember when walking into that ICU, and what were some of the first things you remember the healthcare team told you there?
The first thing, I think it was a very secure area. That was the first thing I remember. And I remember that there were, everybody was curtained off. I couldn't see anybody except my wife, which was good. I don't know. I can't remember. I think I might have had to wear a mask the whole time. Probably one of the first things I remember the head of the team of doctors that had her case said to me was he was asking why she was moved there, and that it was because of her lungs, etc. And she was still unconscious. And he had told me, he said, I don't know if it was that night or the night after, her oxygen numbers started to turn around. So she started getting better oxygen numbers. That was probably my first interaction with him. He was pretty like by the book, like, you know, just, oh, here's what happened. Okay. I only had a few conversations with him. Like I said, they had a team, and they would be in there, and then they would be discussing. Like he'd have, and I don't.
You have a whole little group of team,
Yep.
and they would go room to room.
Yep, and I did not like. They would talk about her. I knew they were talking about her, but I couldn't really hear or understand what they were saying. But I did feel comfortable because I felt like she was getting attention she needed that I couldn't supply that.
Yeah.
So I felt in good hands, only because also the hospital had a good reputation. Okay, that's the other thing. And in the first hospital I took her to had a good reputation as well. She actually had me drive to that smaller hospital, even though we had one closer, because the other hospital closer to us didn't have as good of a reputation. And I asked her, and she goes, "No, I want to go to the other one." I go, "Okay." So
yeah, I think that's super important from just with myself interacting with people, whether it's in an ICU or ER setting, how we communicate with patients and interact with them, and not only take care of patients like you, but also take care of their families and talk to them, really helps build reputation and really build a kind of trust with the community when it comes to certain hospitals. I know the hospital I work at, sometimes they say, no, I'm just going to this hospital because I like it there. The nursing treats me great. Everybody treats me great there. I just want to go there. So I think it's super important for us as providers, not only to develop our bedside manner but just be human, I think. Um, and I know that's kind of easy to say. In practice, it's a little more difficult because sometimes we are rushed and everything. But from hearing from you guys, at least part of the aspect of her care was the comfortability of how you felt
Yeah.
she was being taken care of, which is super important. I think for any situation, whether it comes our kids, our healthcare, whatever, as long as we feel taken care of, it goes a long, long way. And what I'm hearing too is maybe when her lung numbers started turning around, may have been the first time you felt, okay, maybe she's really going to get better.
Mm-hmm.
Now, I remember getting another phone call from my mom saying that, and this is when she first got to the other bigger hospital, saying they had a window and you said to go transport her, and she got to the other bigger hospital, but she told me, I think you need to come in because they're not sure how well you were going to do. And I was a second year medical student, and I never set foot in an ICU up until that point. And my first ICU interaction was, I remember going into the hospital very cleaned up and secure. I remember having to basically go through security and prove who I said I was, basically. And I do remember wearing a mask. They made us wear a mask the whole time. And I remember walking through the doors, and I remember seeing Aunt Stephanie. And it was my first time. Everybody talks about, oh, they're hooked up with all these leads and machines and everything. And now I understand it and I know what all those things are for, but at the time, it's overwhelming. I mean, I remember there was the dialysis machine to the left of her. I remember her being on a ventilator, tons of IV pulls and medications, basically dripping meds into her. And part of me, while sad and worried, was like, this is kind of cool.
That's what I would have
Like,
done too.
the nerd in me was like, wow, this is impressive. This is kind of amazing, but scared at the same time, because just seeing all that, you know how sick someone is. And that was one of the times where my interest in becoming an intensivist or ICU doctor, the first time I started to think about it. And it was very challenging through medical school to decide what I wanted to do. At first, I thought I wanted to be a neurologist, sorry. And then I got to neurology clinic, and I'm sorry to all my neurologists out there, but I realized you can't really cure many diseases in neurology. You can support them and make their symptoms better. There's a lot of good being done in neurology, but it just wasn't for me. I didn't want to do that. Then I thought I was going to be a trauma surgeon, and I did my trauma rotation, and it was fun. But I really could have cared less being in an OR for 10 hours a day and dealing with traumas. Although it was cool, I was like, yeah, I like the cognitive side of medicine, not just I like to use my hand side. I do like to use my hands and do procedures, and then I did my internal medicine rotation, which is like a regular hospital doctor that takes care of the not critically ill ones, the ones on the regular floors, or even sometimes the step down units, which I know you're familiar with. And so I was like, I really like this because you can use your brain. You can do basic procedures. Not saying surgeons don't use your brain. You use your brain, but you think through processes a little more in physiology and pathology, and you have a little more time with your patients. And then I knew I had an interest in emergency medicine because I was an an EMT basic that I volunteered as. And so I was like, you know what, let me just do an EM rotation. I loved it. I loved the acuity of it, the faster pace. I could still use my kind of cognitive knowledge and skills as well as some of my procedural ones in emergency situations and acute care. And so I was stuck. I was like, I didn't know what to do. And then one of my friends who was doing a research rotation up at a hospital in the state up north of Ohio, as I will call it, he was like, there's this emergency medicine, internal medicine residency. You should check it out. And I was like, okay. So I started looking into the programs. Now, there weren't many. There were only like 12. And then I did my ICU rotation right before we applied for residency spots, and I loved it. I kind of remembered all the machines and then I really got to see like what each of the machines, drips, medications did, the acuity of care, having really in-depth conversations with patients. And I was like, I really like doing this. This kind of melds both of those together. And so it helped me make my decision that a couple of the emergency medicine and internal medicine programs also had critical care fellowships associated with them, and I could go into critical care even if I didn't decide to go there through those. And so I decided to do that with the intention of doing ICU work in the future. And it was a real big influence because I remember thinking about those things towards the end of my or middle of my fourth year as we're applying and interviewing through residency, that's what I wanted to do. So it was a huge influence, while scary at the time, looking back, a very big influence of how I decided where I wanted to go with my career and how I wanted to train. So it was eye-opening in my first introduction. And I think, to your point, it's kind of a learning experience in the ICU. I even still learn stuff in the ICU as a attending now. I've been an attending for 3 years after, oh God, 7 years of residency and fellowship training, and then 3 years as an attending. So I've been practicing as a doctor for 10 years, and I still learn a lot of things. And looking back on how sick you were, I think, and as shocking as this may be from what the doctor told you about 50-50, for her, I actually think it was way worse. I actually think it was more 90-10, that she wasn't going to make it through. And looking back on it now just makes me even more proud that I have the chance to help patients like Stephanie get through those critical times, because sometimes, even though we do everything right, part of it is up to the man or woman upstairs, but without us intervening and at least providing very good medical care, there's barely any chance. And it's really been a comfort for me, and is part of one of the things I like about medicine a lot. And so as she started her oxygen, started to turn around, what are some of the next things you kind of remember as she started to recover?
So she was still out probably until, like I said, 5 or 6 days. Her dad came and visited as well, and you can tell that story. She eventually got conscious. Go ahead. Your dad.
And so which?
Well, it was already after they had extubated me.
Yeah. So when?
Yeah.
How many days before she was extubated or taken off the ventilator?
This was a while. She was on the ventilator. It seems to me, Chris, she was approaching like 10 days, and I know that they want to try to get that out because, and I know they took it out, but they were talking about re-intubating her. And I thought they did, but I can't remember because she was having trouble breathing on her own. I thought they did re-intubate you for a few more days, like at least a day or two.
It's possible.
So it was about 10 or 11 days when they first tried to take it out.
Okay.
And then she was struggling, and I think they re-intubated you.
I think they did for a little bit.
Yeah. Because I don't even think you were conscious, or at least she couldn't do anything. But I think probably total time, maybe 12 days.
Wow.
Okay.
Was there ever discussion, if she got reintubated, was there ever discussion about if she didn't do well off the ventilator next time, if they would ever do a tracheostomy?
Yeah.
So likely she was extubated and reintubated then.
Yeah.
Because that's typically what we do. We always,
they had mentioned
especially
that,
young patients.
and they had explained to me that even though that happens, there doesn't mean that you always have that. Which
Correct.
I did not understand. I always thought that if they did that, you would always have that.
You'd have a scar.
But I always thought that you see the people that have to use microphones to talk, and I thought, well, you know what? She's going to be alive. Do what you need to do. But she eventually was able to be taken off that.
Her own. Yeah.
So that was good.
Yeah.
But they did make me feel okay, saying, yeah, that doesn't mean she's going to still have that hold. And because that's a misconception I had. I thought, oh, she's going to be talking through a windpipe the whole time. So for certain patients, like let's say someone with voice box cancer and they have to remove their voice box, they have it for the rest of their life. Yeah. And that's sometimes when they have the microphone.
for someone with like really bad pneumonia or ARDS who's really critically sick and ends up with a tracheostomy if they're young, a good amount of time, I won't say every time because every patient's different, but a good amount of the time after months, now it does take months for this to happen, a lot of patients can't get the tracheostomy removed.
Yeah.
You still have a scar there and you have the old remnants of it, but it closes on
Okay.
its own actually pretty easily. I've decannulated, we call it decannulation when you remove it. We have decannulated plenty of patients that do really, really well, but it is scary at the time because a lot of people think they could be ventilator dependent for the rest of their lives. Some patients, depending on their age and what's happened, like severe strokes, they can be. But some, in situations like what happened to Stephanie, there is good outlook that over time, as you get stronger, you come off the tracheostomy and it gets removed. So it's not uncommon, and that is a misconception in some people that if you get a tracheostomy, especially if you're a young patient, that you're on it forever.
Yeah.
Those type of conversations definitely should be had with the doctor about what the long-term outlook is for anybody listening. It's super important to have those conversations about what it looks like, but sometimes they don't need to stay on it. But I'm glad she did well off the ventilator, thank goodness. It's always scary when they're bringing up those conversations about being dependent on a ventilator for any period of time, especially with how sick she was.
Yeah.
So I hear you had an interaction with your dad. Was that the first interaction that you remember?
Yeah. I mean, it was once I was starting to feel better. I was able to keep my eyes open for days rather than just, a couple of hours. And so they had come in, and I'm like, oh, somebody told me I think that you were going to be there. I don't know if it was one of my nurses or I don't remember. But because I'm thinking I didn't know what I didn't
was
know what
not
happened.
there. It was
I
your
didn't know
brother
any
and your dad.
happened. Was
I
it?
think
Oh,
it was
you
your
were
brother.
there?
No, I
I
was
thought
not
it
there.
was you. So I looked at my dad and I go, what the hell happened? Why am I here? What is going on? So he kind of he told me later on, he told me, he goes, that's when I knew you were going to be okay. Because that was the first thing you said to me was, what the hell happened? Why am I here? So
That's amazing. That's
Well,
awesome.
and you had asked, and I probably forgot details, but you said, like during her time, one of the things that she had is she had fluid on her lungs, so they were draining the fluid,
oh
which,
yeah, they did
which
that with the
they had something that had like would show bubbles, some tube that came
Did you have a
down.
chest tube?
they did.
Yes, she had a
Oh,
chest tube.
Still have the scar.
So you had a pneumothorax too.
Yeah,
Okay.
and
So a pneumothorax is a collapsed lung, which
Mhm.
sometimes really bad ARDS or even pneumonia or COPD patients can get, or anybody really can get one. And you have to put in a chest tube to make sure your lung doesn't fully collapse.
so I was fixated on watching that, seeing the bubbles. They also had the tube that would, or they would try to measure how much urine output.
Yeah.
Because of her kidneys.
For Foley
Yeah.
catheter. Yep.
They would use terms like putting in an A line and stuff like that. And I'm like, I have no idea what you people are talking about.
You know now.
But I know
Yes,
now. But it was scary because I did not know what they were doing, but I trusted them.
Yeah.
So.
And I'm sure you probably, I think I remember at the particular hospital you may have gone to, you signed a consent that covered most of the procedures in the hospital. I'm sure occasionally they may have reconsented you for other procedures that they needed to do.
She started getting better.
Yeah. So part of the standard process, we have to get consents for procedures that we're going to do, unless it's very emergent. Then we use what's called implied consent, where if you are in an emergency situation, what is the reasonable action a reasonable person would decide on? So like a good example would be actually when he first started talking about you were in the emergency room, and as he went out to make the phone call to your boss, you probably decompensated very rapidly and they couldn't get a hold of him in a reasonable fashion. And so they used implied consent by saying this is an emergency situation and a reasonable person like you would say okay to being on a ventilator to save your life. That's how we use implied consent in emergency situations. Now, if it's non-emergent and, we have time to do things, we consent people. We explain the risks, the benefits, the alternatives. You can say yes, no. We can discuss with you in a kind of what I call a patient-centered way of what you think the next best steps are. And so that's how we try to do things in the hospital, except in emergency situations. So there's a lot of terminology that's thrown around in medicine. And I think that's one of the hardest things as healthcare providers, is to make sure that our families and our patients are on the same page with us, because just like anything, you're an engineer, you have your own set of lingo and jargon that you use, just like we do in medicine. And sometimes the layperson doesn't understand what we're talking about, like A-line. A-line means arterial line. It's a small catheter that we put in the wrist, in a groin area, sometimes in the armpit, or in kind of like the elbow joint. Rarely in the elbow joint, but sometimes, to constantly monitor blood pressure, to adjust those pressors, the blood pressure supporting medicines that we have to titrate up or down. Central lines, which are like big catheters that go in the neck or groin.
She did have a central line.
Yep.
Yeah,
In the neck or groin, to give IV medications or to do dialysis, those type of things.
Yep.
And so I think it's super important we communicate those things in layman's terms as physicians and healthcare providers about what we're doing in a way that patients understand, because they're not going to understand what an A-line is, what a central line is, but they'll understand when I say, hey, we need to put a dialysis catheter in. It's basically the width of a straw, okay? And it goes in your neck, and we use an ultrasound to see where it's going, but there's XYZ risks associated with it. The alternative is to not do dialysis and then medically treat, but there's always a possibility with death if we don't do dialysis. Those are the type of conversations we have. I mean, I have them on a daily basis, and I think it's important to put that in terms patients understand at whatever that level may be. I've had patients who are in the healthcare field or closely related to the healthcare field, and I can talk in jargon, and it makes it kind of easier in that situation in certain regards. And then I have other patients who aren't in the healthcare field and, like you, have very limited knowledge of what's going on, and then I just basically relay it in terms that they understand. I usually ask what people do for a living, because I can create stories and draw metaphors off of that, and it makes it much more understandable. And I think that's an important way that we as physicians and even any healthcare providers can relate to our patients and explain it in easier terms, where it's like, oh, I get that. That makes sense. So I know it was tough having all those things done to you, Aunt Stephanie. Some of them you remember, some of it you don't. When was the first time you remember seeing your kids? And what did that feel like?
They wouldn't let Christy come for a long time.
Probably not. She was super young.
Yeah, she was only 6.
She saw Taylor and Trent, I think.
Yeah, when
while
I was
she
in
was
ICU.
while she was still in the
But
ICU,
getting a little bit better.
getting a little bit better.
And
Christy, she did not see Christy
until I was
for
in
for
step down.
like a couple months, like
Yeah.
at least almost 2 months probably.
Yeah. It was
So, and our daughter, was she
6, you said at the
6?
time.
Yeah,
She was like mid-January, I think, and then
maybe February even.
she was showing me how well she could read because she was reading all
Yeah.
my get well cards to me.
Oh.
And I'm like, I would have thought that he prompted her because she was just like, her fluency in reading. I'm a teacher, so I noticed that her fluency in reading was blowing my mind. So I'm like, I would have, had she not opened the cards there in front of me, I would have said, you practice those with her.
I didn't have time.
He goes,
to
I didn't.
practice.
So,
Wow.
but yeah, it was a while.
How did that feel when you saw your kids?
Do
you
It
remember?
made me kind of sad a little bit because Trent was in karate at the time, and I couldn't go to see him get his first black belt, so I was bummed about that. And then Taylor was on his freshman trip to New York City, and people were getting these awesome pictures of like the Empire State Building and Grand Central Station, and I get this picture of a rat that had been run over by a taxi. I'm like, really? This is what I get? The good thing Grandma showed me her pictures. He's like, that rat is huge.
So
And
it's
it
a
was a big rat.
little sad
But-
about missing out on
Yes.
some of the
Yes.
things in
And
life
then-
that
Yeah.
you didn't get to experience
Yes.
during that time with
Yeah.
them. I can understand that.
Yeah, it was
Especially
really
now
sad.
having kids
Yeah.
on our own, I definitely
Mhm.
can relate to that.
Yes.
The fear of, or the desire to be there and not miss out on those
Mhm.
I mean,
important
she
things.
kind of missed Christmas because she was
Oh,
in
yeah.
the hospital.
Yes.
You
And
guys took videos.
and the only thing I can say is she's very organized. So she would keep a notebook of
Yeah.
what Santa was bringing. Trying to,
I like how you whispered
I know.
on the podcast.
I know,
Like
but,
the microphone isn't going to pick
I
it
know,
up.
but
Kiddos.
but she also used her own lingo
Yes,
and
I did.
abbreviated stuff. And I'm reading this list going,
What
I
the heck
don't know
is
what it is. Well, she bought the kids a video game, but she had WIR. I'm going, I have no idea what it is. And I still didn't. Well, it was Wreck-It Ralph. But but the only reason I knew, because she was still out, the
Mhm.
only reason I knew is she kept a notebook, and I knew where that notebook was.
That's awesome.
Yeah.
That's pretty cool.
So she still got to give the kids what she wanted them to have.
That's great. That's great. So it sounds like she was on the road slowly recovering.
Yep.
What was the day like, and what was the feelings for both of you when she left the ICU to go to, I
Well-
think you told me before, she went to a step down unit.
Before that, though, I'd like to say there was
Yeah.
one other major thing that happened to her.
Yeah.
She developed, at first
Oh,
we
yeah.
thought she was having a heart attack,
Mhm.
Oh.
and they were unsure what was going on. So
That was a fun night.
this
It
was one of the
wasn't-
things.
I
Even
mean-
though she
And
was
she was
awake,
off the ventilator at this
she was
point.
off the
Yeah.
ventilator, even though she
Okay.
was awake and everything, she could not use her hands.
Mm-mm.
So they wanted consent to go into what is it called? The where
Heart
they-
cath?
heart
Yes.
catheterization. And
I
this is that
couldn't- I
conversation we were
couldn't
saying
sign.
is, if you don't do it, she could die because she may be suffering a heart attack.
Yeah.
If we do it, they said she's so weak, she might not be able to get through that procedure. So I'm sitting here and I'm having to go, what do we do?
Those
She
are the
goes,
hard conversations we have.
And
It's not
so
easy. It's
we
not
ended
easy for
up doing it.
patients or us.
Yep,
Yeah.
we ended up doing it. But she had some heart things going on, like
irregularities of
Yeah.
vessels.
yeah,
and
like
stuff.
like and I forget what they had. They showed all 4 chambers,
our-
and things were not electrically. They said her heart was good. Mechanically, it was having some issues.
Yeah, I was a
Um,
little tired.
but
That's
what
how
they
she put it to
finally
me.
diagnosed her with was myocarditis, which they said, okay,
Wow.
yeah, that's
Mhm.
inflammation.
Yeah.
And so they treated her for that. I think they treated it with like aspirin or something
Yep.
like that.
Yeah.
So, but it scares you. But it
Anti-inflammatories.
scares you
And it
when
was scary
you
Sometimes
hear
too,
a term,
I was,
and I'm like, I don't know what that
I'm
is.
in my, I was in my room that night feeling pretty good. I'm pretty sure I got my days and nights mixed up when I was out. So it's like I could not fall asleep at night. Like could not. So I'm in there. At the time, we were really into the Big Bang Theory. So I was watching the Big Bang Theory, and all of a sudden these nurses come crashing into my room, open my door, and I'm going, they're like,
What's
oh,
going
you're
on?
having a heart attack, is what they said. And I'm going, I am? And then I'm really freaked out.
And
you
she
know?
started like really feeling pressure, and it wasn't going away.
Right.
Wow.
Yeah, and so that's the thing when you have to make those decisions. It's if you don't do it, it could be really bad.
Mhm.
But if you
But
do
if
it,
I do it, they said it also could be
Be
really
bad.
bad.
And
It's
And I'm
hard.
like, oh,
it's
I don't-
nerve wracking for every one of us because, especially imagine the interventional cardiologist. They're paid to do it. They do things well.
Yep.
But they know every time they take someone to the cath lab that there's a chance that the
Mhm.
patient doesn't survive the procedure.
Yep.
In certain patients, the risk of them not surviving is higher.
yeah.
Certain patients is lower. And it's always a balance of risks and benefits. And what it sounds to me like she had is potentially what's called either pericarditis or perimyocarditis,
Okay.
Maybe
which
that's
is
what it was.
inflammation of the membrane surrounding the
That's what
heart
it was.
Yep.
That's
or inflammation of the heart itself.
I think it was the membrane surrounding.
Yeah, so
Yeah.
the aspirin and anti-inflammatory is a pretty standard treatment for it, and not uncommon after something like influenza or some other viral illness, which
Yep.
is, and usually you don't get it for sometimes days later,
And it would have been.
and it
days
would have
later.
been probably weeks
That's like
later
I
at
said,
that
'cause I
point,
remember I was
which
watching
happens.
TV.
So it can be pretty scary, and it can actually mimic on like EKG or the monitor a
That's what
heart
they were-
attack.
That's what they were
It
watching.
can mimic that
Yeah.
depending on how much of the leads and stuff are involved. So you're a very interesting medical case.
Oh, yeah.
For sure. You had all the things.
I
Well,
definitely did.
all the things.
Well, there's one more thing. We told you she was on depressors, and one thing we
Yes.
didn't mention is
Oh,
those
yes.
depressors, because of her extremities,
Losing the blood flow is how they
she lost
explained it to
blood
me.
flow, and her hands were, I
They
assumed her
messed up,
hands
but they
were
okay.
going like this because of her being sick,
Yeah.
not because of the pressors. But her feet, they were black. All her
Yeah, the
toes were
toes.
black. Some of them were like flat,
Mhm.
and I didn't care at the time because she was still alive. I'm like, okay,
Absolutely.
they'll solve that problem when they
Yeah,
come
well,
to it,
Yes.
Yeah.
And they said really they can't do stuff because she was so sick. It made no sense to even start thinking, what are we gonna
Yes.
do?
Yes.
So that's probably the things that I noticed, like through that first initial 10 days or so,
Mhm.
you know.
Well,
Yeah.
that's one of the first things I noticed too, and
Oh,
I
she's
remember
funny.
thinking in the back of my head, like, those are not coming home with me. I mean, I knew it. I'm like, they're gonna tell me that has to be amputated. We'll just wait to see how long.
We'll see what
It
they
took a
say
little longer
later.
than I thought it would, because it didn't happen to what, February of
Yeah,
2013.
So were you out of the hospital at that point when
Wha-
they took off your
No,
toes,
they
Yeah,
or
put.
still in the
I was
she
hospital?
was
still
still
in
in the
the
hospital. She was in for
the
she
recovery.
was in a total of the hospitals for 76 days.
I was in the third hospital for
Yeah,
that.
she was in the third hospital. So she went to
Wow.
a step down,
Mhm.
and she can tell you about her experiences there.
Yeah.
I mean,
Well,
they were
started
okay, good.
started memorizing the menu. I knew, like, oh, it's Monday, so they're gonna have these choices and these choices and this choice for lunch and dinner and breakfast. And I'm like, I gotta get out of here.
Yeah.
I got the
But-
menu memorized.
But she was you were in the step down only for maybe a week or two, I think. Maybe a couple
Well, which
weeks.
one are we talking about? The
We're
second or
talking.
the
We're
third?
talking. You're still at the main
Okay, yeah,
campus.
the
So you went there, and that was only like a
Yeah.
week or two you
Yeah.
were there.
Yeah.
Okay, and so that hospital was the one, or that unit was where they were trying to get her out, you know,
Yeah.
and they wanted to move her to like a nursing
nursing
home
home.
type of rehabilitation center, but she was 41. I don't know if you guys can get the impression of her from this video. She's kind of spunky. I knew that she would work hard to do what she needed to get where she needed.
Yeah.
And so I kind of fought them saying, no,
Mhm.
I don't want to go in there. And that's how we ended up getting her transferred to another hospital that had a rehabilitation unit in it. So
Okay. Well, what was the recovery like in the step down unit as you were coming out of the ICU for you, besides the menu and the hospital
Well,
food?
I knew.
you
I
can
knew
tell
when I
the
had
sto-
the menu
well,
memorized. I'm like, I've been
tell them
here
the
too
story
long.
about the guy that.
Oh,
Yeah,
that guy. Well, that was at the second one, the second facility.
No, that's
but,
what he's talking about. That's what he's talking
yeah.
about. That step down unit.
Well, there
Yep.
was.
No, that was the place where that guy told you that. Go ahead.
Yeah.
It was a
He
doctor.
told me that twice. I was ready to.
So
He-
what happened?
He didn't believe that I was just really sick.
No, not that one.
He's like,
The one about your hands and stuff.
yeah, that's the same guy.
Oh, okay.
It's the same guy. He really thought that I was a drug addict or something. And he kind of told me that one time when no one else was in there, before I could even really respond to him. And I'm like, what is this guy's
Deal.
deal? What's his problem? Like, doctors can be like that with people? You know, that's what I'm thinking in the back of my mind, because I never had an experience like that before. Well, any of that, I'd never had an experience like that before. So I'm like, what is he getting at? I'm like, I am a 7th grade teacher, for crying out loud.
Yeah.
You know, I have 3 kids of my own. It's like, I didn't do anything to. I got sick and didn't know it. That's what.
You got flu. It's
That's
not,
what happened.
not uncommon to get flu and
So-
then a serious bacterial infection on top of it on your lungs.
Okay.
It's not uncommon. It's actually
and
we
I
see
didn't
a
know
lot.
before that too that strep could travel your body. I didn't
Correct.
know that. So I was just thought it always stayed in your throat. You know,
Yeah.
that's what
Yep.
it does. You know,
Yep.
it just stays there. But yeah, he told me, he's like, well, you'll never teach again, because you're never
Yeah.
gonna be able to walk again. You're never gonna use your hands again. So you know, you could just forget it.
Wow.
And then I'm thinking, okay, and that was before I could do, you know, and he wore
Anything.
he wore these Converse too, these blue Converse.
Amazing that you
So I was-
remember blue
yes,
Converse.
Blue Converse, because I'm like, if I see those walking in my room, he's gonna get it. So
I can't move my arms, but I'll
yes,
get them.
I will do something. I will scream at him something. So then second time I saw him, he was with like another group. Like, he made it very clear that I was not one of his favorite people in there.
But
And I'm
he
thinking,
was
I didn't even do anything to you.
He was
You
with the
know?
person from the hospital that was going to make that decision about trying to get her into a rehab facility.
A nursing, like a
Yeah.
skilled nursing rehab
Or
Yeah.
facility.
something like
That's what
that.
they-
Yeah.
yeah,
And,
that's-
and that person, and actually that person would not be there when I was there. Remember?
Yeah,
He
that
goes,
one guy.
they would always show
Yeah.
up and talk to her about it, but I was not there. And I go,
Yeah, that
I
one
need to
guy.
be there because I'm telling them what I
Yes,
want.
that one guy.
Yeah.
Yeah, he was a little weird too, but I think he just didn't like confrontation.
Well, I
And
was
he
going to
could-
confront. I
he could
wanted
tell
him to
we
put her
were,
where she should be.
Yeah.
You could kind of tell we were strong people, I think.
I think that circles me back to a point too that I know you guys know I take this very seriously and personally, and really having a good bedside manner with patients and trying not to make assumptions about people. It's very hard because we do it as human beings all the time.
Yeah, we do.
We make assumptions, we make judgments. Unfortunately, it's part of human nature to do it, but it's important to catch ourselves if we're doing it too frequently or in inappropriate situations. And I think one of the reasons I'm very conscious of that is because one of the things that got me into medicine and my original experience I had that really motivated me and inspired me into going into medicine was the type of interaction I had at the bedside with somebody.
Mm-hmm.
And this was during my time at John Carroll when I was an EMT basic in training. And, we go through all the classroom stuff and everything. You do your book learning and tests and all that, and your skills challenges to test out so you can see if you can go on ride time and get your clinical hours. I'll never forget, it was one of my last ride times, and it was a very long shift. They were like 12-hour ride times that we would do, and we were at the tail end of the shift. And I remember we get called to this nursing home, and this patient gets wheeled out by the other EMT and paramedic that I'm with, and he's rolling out, and you could tell he's a little short of breath, and they have him on an oxygen mask, a non-rebreather mask, giving him 100% oxygen. You can tell he's a little short of breath, but not struggling too much. And, I have no medical training. I have the book knowledge, but I don't have the clinical skills and yet. And so they put me in the back with him and said, all right, you'll ride in the back with him. And my butthole was about as tight as a rock. I was like, wait, what? You're going to leave me with this person, like, when? Now? By myself? And I was like, oh my goodness. And I get back there, and like, I remember he's like trying to take off the mask. I'm like, no, keep the mask on. We're taking you to the emergency room, blah, blah, blah. Talking to him. And then I go, you know what? I start asking him questions like, what do you used to do for a living? What's your life like? Like, what do you remember the most that you miss? I'll never forget this conversation with this guy. It was probably honestly about a 20-minute conversation, but it felt like it went by in 2 minutes.
Mm-hmm.
And he would tell me about how he used to love going golfing with his grandkids and his son and walking the 18 holes and going camping with his kids and going on road trips and just being able to walk his dog because he'd been in a nursing home probably for at least 2 years at this point, in and out of hospitals with chronic illnesses and acute illnesses. And we just had a good conversation, and he kind of had his face mask to the side because I was like, no, you got to kind of keep that on, because I was still kind of like very green and worried like I was going to hurt this person if I don't keep this on. And I'll never forget wheeling him out to the emergency room, and we're getting him ready, and he just grabs me and he just looked at me and he said, thank you. I was like, I didn't do anything. I just kept your face mask on. And he's like, no, he's like, this is the most in-depth, best conversation I've probably had in the last 6 months to a year. And he goes, just talking to you just made me feel better. And that, to me, the relationship with people and getting to know their experiences and then communicating with them what's going on really has inspired me to go into medicine. Because my wife can tell you I'm a nerd at heart. I'm really nerdy, and I really love science. I knew I loved science and math and those type of things. And then once I had that human experience with that patient, it really set me on a trajectory like, this is what I want to do, because I want to be able to not just help people, but kind of connect with people, and be able to give them that time. And I think sometimes there are physicians who are really good at it, and there are physicians who I'll say could use some work at their bedside manner. And I think we all know that in medicine, and it's a very big stress that we have in bedside manner is super important. And I know it's taken me a long ways when I developed my communication skills in bedside manner. I don't know how medical school is nowadays, but I remember when I was in medical schools, communication skills were not taught as intensively. And I wish that was something that could be taught a little more intensively, because I think it provides the most benefit to the patients and their families, because by communicating in an effective way and relaying information in a kind of way the patient and family understands in their own lingo and understanding, makes them feel more comfortable, speeds up the recovery process. And somewhat selfishly, as a physician, our job is to persuade you to do things that we do think would provide you the most benefit. I think by communicating in effective ways, it makes it easier. Sometimes we don't even have to convince you at that point, and you just reach the conclusion on your own. And so that's been a really big stress for me. It's inspired me and also motivated me to be a better communicator in my own practice, even though sometimes it's hard. In the emergency room, in the ICU, we're so busy, we're burned with administrative tasks that's led to burnout, etc. But I still think it's super, super important. And it kind of reminds me of that, is to not make assumptions about your patients and to try to communicate with them as effectively as you can. It'll provide benefits for everyone, not just us as doctors, but it's families and patients. I think it's really important. Um, how did you feel most of the time? I know you said, Uncle Chris, that you felt, especially at the both hospitals, you felt she was getting the care she needed. Now at the bigger hospital, you felt like she was getting more attention. It sounded like that she really needed, which I think at that point was warranted for how sick she was, for sure.
Yeah, they had
And
said one
so
time that she was the
sickest
sickest
patient
person
in the
hospital.
ICU.
Yep.
Yep.
They say actually in the hospital, I think.
Yeah.
'Cause I
It's
think
very
that's one of
possible.
the doctors told me.
Yeah. It's
So,
very possible. So it sounds like you felt like she received good care, which
yeah,
is,
I do.
I think our healthcare system has done a wonderful job in acute illnesses as far as treating patients. Some of our chronic illnesses, we have some work to do, but acute illnesses, we do a really good job at kind of fixing disease in a lot of these instances with the advent of antibiotics and all these tests and interventions we're able to do. Very, very helpful. So you were in the step down unit and you started to recover there. And then we heard that you went to what sounds like an acute rehab facility. I don't know if that's exactly what it was.
I think it was.
Yeah, that's what it sounds like, because from what you're describing,
It was just attached to another hospital.
gotcha.
But they
What
have-
did they use the term LTAC, long-term acute care facility?
No.
Okay,
it
so
was
it's
on
probably
LTAC.
so some hospitals have a hospital and then an acute rehab facility attached. Sometimes that
Okay.
happens.
This was actually part of the
It-
hospital.
yeah.
It was a
It
floor
was
on the
it was like a
hospital.
wing of the hospital.
Yeah.
Yeah.
Okay.
Yeah. So she was like, I forget what floor she was on. Actually, it was kind of cool because the floor she was on, it was on the shore of Lake Erie.
Oh,
And she could
that's
look out.
cool.
Well,
Yeah,
she
well.
couldn't look out the window,
But
but
my-
they would raise her
They
bed
would
up
raise
so
my
she
bed
could
up
see.
so I could see the lake. 'Cause
Yeah.
Oh, that's cool.
They knew I liked the lake, and they knew that I liked going to the beach in the summer.
Oh, that's nice.
So they're like, "You want to see the lake?" I'm like, "Yeah." So they whisper it.
But I,
So
but I
we weren't
think it
supposed
was
to be
not.
doing that, but
Yeah.
We bend the rules in healthcare to help our patients. I've wheeled very sick patients out to let them go outside who've
Yeah.
been critically sick and just off ventilators, to get them some fresh air because they enjoy the outdoors. We bend the rules occasionally. It's not often, but when the situation calls for it, we bend the rules a little bit. So
and then they let him bring in. That was the same
Well-
hospital. They let me bring in Mexican food from our favorite Mexican
Yeah, I kind
restaurant
of snuck it
because I
in
had the menu memorized.
again.
yeah,
And I'm like, I can't do this. I want a burrito.
I want
loco.
real food. So what was rehab like? So obviously you were very weak
yes, at
going into
first.
rehab at first, for
And
sure.
then, I mean, but
And-
I
and
felt more
well-
comfortable because then there was a lot of people there that, in my mind, looked, I mean, we were all trying to get to the better version of ourselves because, I mean, there were people there that had, I mean, there was a lady there that had some sort of neurosurgery. So she actually had on like what you typically see babies have on their head. She had on
Like one of those
one of
halo
those
things.
helmets. Yeah, she
Yeah.
had one of those helmets on. And another lady, I think, had a stroke.
Wow.
And another gentleman in there lost like half his leg. So, and I hadn't lost my toe yet
Oh yeah.
at first. So,
So they were working on your core.
they were working on my core muscles, trying to teach me to walk again. And because I don't think well, I had to do it. No, I didn't, because after you have your amputations, you can't put your legs
Yeah,
down
they
right
tried to
away.
have her walk.
So they tried to have me walk. And that was going pretty well until I threw a pulmonary embolism.
Yeah, what was that like? Like
Um,
I said, you had all the things.
I did. I
You literally
really
had
did.
all the things. It's
And was that when they put the filter in then?
Yeah.
The IV filter after that day, after I pulled that little trick?
Yeah.
That's why I say I do my own stunts.
Yeah.
Never intentionally.
so
but-
when you had the pulmonary embolism, did they send you back to the emergency room from that
what
hospital, or
what
took you
they
into the
kinda-
hospital?
I think they already kind of knew
Mhm.
because they called the physician like right away. Like they hadn't even taken me back to my room yet.
Yeah.
And they said, we're going to take you back to your room because you need to see your doctor. So I think the nurses there knew what was going on because they stood up. I wasn't feeling well that day anyways when I woke up, and I didn't know why. And probably the worst I'd felt since I got to that facility. And so they stood me up, and then I got real dizzy. and then I threw up in front of everybody, which still like I'm still mortified by to this day. And then they like, no, it's
So
okay.
you were the puke
And
lady.
yes, I was that day. I was. And then they sat me back down and they said, well, we think you're done for today, because I really think that they knew what was going on. And then like, you need to go talk to your doctor. So
Well,
he's like, I think you've got a blood clot in your lung.
well, and they did
And
Did you
X.
get a
They did.
CT scan?
Well, yeah, they had some kind of thing
They
that
did something, I
that
don't remember.
showed the blood clot, whatever. Because I talked to the doctor because I had questions. I go, okay, what are you
What
gonna?
happened?
Well,
Oh,
no,
what are
what are
you
you gonna
doing?
do with this? And he goes, well, in many cases, what happens is the blood, it will reroute around it, or we can give you
Resorb it.
medicine that might like dissolve it and stuff. But your body's amazing because it'll do things like that.
Yeah.
But to me, that was even more scarier because
Yeah.
you hear about that and people
People just
die.
Yeah.
we
You know?
just had friends of ours whose daughter-in-law, she's 26,
Like 20-something years
27
old, and she died of
a pulmonary embolism.
Yeah.
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 So
Like that fast.
We see it in the emergency room. Young, healthy people come
Mhm.
in and they're on the brink of death, and then we find a pulmonary embolism, and that's the cause.
Mhm.
It can be scary, and you being recently critically hospitalized
yeah.
put you at
That's
a very
probably
increased risk
yeah.
of developing one. And did they have you on blood thinners then afterwards for a certain duration of time?
yes, yeah.
Probably like
Oh,
3
yeah,
months
they
or
have
6
had-
months.
Yeah, Lovenox.
Oh, Lovenox.
Mhm.
Okay.
Yep.
So you had to inject yourself?
Yep.
Oh well,
Or you
no,
did?
I did it. And then I have no. So the nurse comes in because this is this was when the pulmonary embolism happened for probably a couple weeks before you went home. I think.
Yeah.
You didn't come home. Yeah, and so she was still in the
I
rehab
don't even know if I
facility.
had my amputations yet, because
Uh,
they wouldn't let me do physical, like they wouldn't let me go downstairs because I wasn't allowed to walk
yeah.
for a while because they didn't want me blowing my stitches out.
Yeah, from your feet.
Yeah.
Yeah.
Well,
So the pulmonary embolism happened first.
yeah, and she can tell you more. But
Oh, maybe.
when she was finally going to get discharged,
Mm-hmm.
the nurse comes in, says, "Oh, you're gonna have to do this." I'm looking at her like,
Oh yeah,
"What?"
the Lovenox.
So she takes it. She goes, "Here, you jab her in the stomach,
Inject.
inject." So I'm like this. She goes, "No." And I'm going, well, everything was okay. I hated it. I hated it. I hated it because one time I did it and she started bleeding, and I'm going, "Oh my god,
We
this is a
didn't
blood
know.
thinner. She's gonna bleed to death." But
No.
but you know me, I'm
It's
thinking
scary. It's
I
a
just-
blood thinner you injected,
Yes,
and you're like,
yeah,
oh my God,
and
is she gonna...
and we're at home at that point, and I'm going, "Oh my god," I'm like freaking out. She goes, "Okay, let's make sure." So it did clot up and stop eventually, but I was. When they come in and tell people, they shouldn't let somebody know you're going to be responsible for it. Not like, "Oh, you're doing it now." And I was like, I don't have any
I mean,
Any
experience.
medical
they told us, they're
experience.
like, well, when you bleed like that, you're going too deep. We're like, oh well, we didn't know that.
Yeah. Like,
Yeah.
I was stressed.
Yeah. I mean, that's stressful to inject any type of medication. And I know it's something that diabetics struggle with when
Yep.
they're first getting on insulin, whether you're type 1 or type 2.
Yep.
Like, it's scary to inject yourself. Some people are afraid of needles. Sometimes you bleed a little bit and then you can freak out, especially if you're on a blood thinner. It's a challenge.
Seems like a lot of blood.
For the little tiny
yeah.
prick. Yeah.
So, like, I'm like,
Yeah, absolutely. So then you were on the blood thinner for a while, and then before you went home, you got because of the lack
Because
of
of
blood
the-
flow and what we call ischemia to your toes, you had to
Right.
have them
no,
removed.
they actually called it necrosis.
Yeah.
So
So once you lose blood flow, the hope was they were hoping that with then restoration of blood flow, once you were off the pressers, that then your tissue would start to
'cause
revitalize.
My
but
hands did, because my hands started to get kind of weird looking at the fingertips.
yeah, but then those recovered over
Mhm.
time. So what can happen is your body is also cool in this regard. So even though your tissue in your toes didn't revitalize and recover, your body then goes, oh, this tissue's dead, and it basically starts killing it.
Yeah.
To try to, so eventually, even though medical personnel, probably a surgeon or podiatrist or somebody removed your toes, even if they would have let it go, two things would have happened. One, eventually your toes would have fallen off.
Right.
Because your body would have self-amputated, but it puts you at an increased risk for infection.
Right.
Yeah.
And so the idea is when you get surgery to remove like what they call necrotic, or they probably also called it dry gangrene
Yeah.
on your toes at some point because it wasn't actively infected. And so to prevent active infection, you remove them kind of
Right.
prophylactically because they're not going to
Well,
recover.
that's what they told me. They said you'll start feeling better once they're gone.
Yeah.
And I
And
did.
and so this leads me to, what was it like to have to learn to walk again as a, how old were you? 41 at the
yeah.
time? How was
Yeah.
that experience? Because I think we've we learned to walk so early in life that me and my wife were just talking about this the other day, what it would be like to have to relearn to walk as an adult.
Well,
She's a bad patient. I
Yeah.
have to tell you that.
yes, because after I had amputations, and they also clipped my Achilles tendon. Was it the same time,
No, it
or did
was
I
a,
need to
it
go
was,
back
it was
in
a
and
little
get
bit
that done a
later.
little bit
They
later?
had to
But
they had to lengthen her Achilles tendon by
so
like severing it or what. Or, you
Oh,
know, they
yeah.
so
they
then
cut
they
it
put me in
and then they put her in boots
like boots that would
that
pull,
extended it.
yeah,
that would pull back up, like
but she wasn't allowed to walk in those boots.
yeah, but I did. but I did, and I went in for one of my podiatrist follow-ups after that.
He knew, didn't he?
He did.
Yeah.
Oh,
Oh
yeah.
yeah, he was
We
like
can
looking at the
tell.
bottom of my
We can
the bottom
tell.
of the braces. He's like, "Are you walking in these?" And I'm like, "No."
Yeah. I should have told him.
was.
I should
I
have
had
told him.
3
Ask her.
kids.
I should have told him to ask her about the split she did in the kitchen
Yeah, when I was
because they were
walking
like
in those.
they weren't really meant to
They
walk
weren't-
in.
no.
Some of them were like kind of smooth.
Yeah, because I was walking in them.
Yeah.
I wasn't supposed
And
to be.
and so I heard too that you got stuck at the top of the stairs when you
Yes.
got home
Yeah.
with the boots. You had the
Yeah,
boots
I
on.
had the boots on, and I'm like,
So why
you
did
went
you
to the
go up
store.
the stairs?
I went because I was not home to get what she wanted.
I
and
needed
she,
something up
she's,
there. I'm like, I
she's
think I can
stubborn.
get it.
This is why I said
I can
she
get
needed to
it.
go into the other rehab place
Yes.
because she ain't waiting.
No,
Okay.
and I did it. And like, I can get it. I'll just go up there and grab it. I don't remember if it was like a piece of clothing or I don't remember what I
Something.
wanted.
But this
Something that
was it-
probably could have waited.
yeah,
probably,
forever.
Yeah. So I scooted up like they showed me in physical therapy, scooted up the steps on my butt, and then realized, and then walked to our room to get whatever I need. I'm like,
That you
"This
weren't
is-
supposed to
this-
do.
right, that I wasn't supposed to be doing. I'm like, this is a piece of cake, no problem, I got it. And then I'm like, oh wait, how am I gonna get back downstairs now? So I just stayed at the top of the steps and waited till he got
How long did it take for him to get home?
Or maybe
I don't
10,
know.
15 minutes.
I
I
don't
don't
know, but-
Okay,
remember.
so not too
Yeah,
long.
but it
That's
wasn't
good.
She's
too long.
calling me.
I go,
And I-
hey, can you
I'm
come
cool.
here? He's like, where are you? He's like, you are not upstairs. I'm like, yeah, yeah, I am.
That is so I'll ask him. We were at dinner the other night for my parents' wedding anniversary, and we had some cute couple questions that we asked, and I kind of want to relate it back to this. What was one new thing you learned about each other during either the acute illness or during recovery that you didn't expect?
He's a crier, and I'm not.
I
I thought I was always the crier. Well, really,
Probably.
but
Probably.
I don't know, we knew each other pretty well. I
Yeah,
think,
but she was not gonna let anything stop her.
no.
So
But I think you knew that about me.
yeah, but you would think something like you're losing your toes. You would be down and out, saying, "Oh my
Yeah.
God, what am I gonna do?"
Well, I love.
but tell them what you said.
Yeah, because I was eating my dinner the night after they said they were gonna
cut your toes off.
cut your toes off, and it was like what, a Friday night, because they did it on a Monday,
Yeah.
right?
Mhm.
Because I don't think it was Sunday night. I think it was right after they told us.
Yep.
And I was expecting it. Like I said, I mean, when
Yeah.
I woke up and I saw the condition
'cause-
my feet were in, I'm like, yeah,
Those coming up.
that's not coming home. So I'm like, we'll just see, like, we'll just see how far. Because, I mean, when your body looks like that, and like I said, my dad was a paramedic. I had heard stories. I kind of knew something that all the foot wasn't coming home with me. I knew that. So I was kind of waiting for them to tell me.
Mhm.
And then I had actually suffered too, when I was a kid and into my early adulthood, really bad ingrown toenails on my
Ooh.
big toe. And like it hurts so much, like
She
to
would,
walk. I
she
couldn't
would
walk.
pack them with
I
like
couldn't walk.
gauze or something.
And
it was
So
all the time.
one
I'm like,
podiatrist showed me how to to
Pack
pack
them
it with
underneath.
gauze
Yeah.
and Neosporin and yeah. We got a story about that too. Just so that wouldn't happen, so infection wouldn't happen in there. And so I'm sitting there eating my dinner, and I'm thinking, well, you know what? I'm not gonna have to worry about that anymore. I don't have to pack my toes
That's
anymore.
what her thinking was. I don't think
And,
that's,
and I'm sitting there, and I look at,
I'll
I
lose
guess
my
I,
t-
I
lose
guess
my
I was deep
toes.
in thought, but I wasn't devastated. I don't,
Like, I'll lose my toes, but I
know?
won't have to
Yeah.
deal with these ingrown
Yeah.
toenails
and
no more.
they were
And
painful to her. So
they
she's
were
going,
very painful. So I was like, eh. And then I said, I'm also going to save a lot of money on pedicures.
Oh my God,
I mean, I'm
that's
not
so
going to have to
funny.
worry about that anymore.
That
No.
is so funny.
So
that's
but
who
what
I'm
he
married to.
He goes,
So
what are you thinking about? I'm like, I'm going to save a lot of money on pedicures.
this experience was definitely a challenging time in your guys' life,
Mhm.
and definitely changed a lot of different things and showed a lot of resolve in what you guys went through as a family. But I kind of want to know, from your perspective, since this happened about 13 years ago,
Mhm.
12, 13
I
years
can't
ago now,
Crazy.
what has changed in your life as far as your perspective and how you lead your life differently? And
I'm actually, I think, a little more confident because I'm like, I conquered this, you know? I'm like, come on. I mean, just the other day at school, we have this, they don't want to sit down at bus, waiting for their bus. They've been sitting all day. They don't want to sit down waiting for their bus again. And this one little girl had on a leg brace, and she goes, I'm crippled. I can't go sit down. I said, don't talk to me about crippled. I said, I don't have toes and I can sit down. And she goes, you don't have toes? I said, no, I don't have toes. I said, so I know for a fact you can go sit down. Yes, I've had to wear a leg brace too. I know they're a pain, but you can go sit down. So for me, I'm a lot more confident, and I just kind of, I mean, I was kind of said what I thought anyways,
Yeah.
but I'm a little more free with that now. Cause why not? I mean, life is short. So that's what I was telling him: eat the donut, take the trip, buy the shoes. How
I
about for you?
I think I'm amazed how far she came. We do whatever we want. I mean, when she first was recovering, she spent months in a wheelchair.
Yeah.
We even went to Disney, and she did not think she could walk. She had to wear braces
Yeah.
for a good, at least a
Oh,
year or more, maybe a
well,
couple years,
7 years, I think, because they finally started, and my doctors told me that would happen.
that they started hurting
That
her legs.
I probably wouldn't need the leg braces.
And so I would push her
forever.
around on a wheelchair, but we would go wherever we wanted.
Mm-hmm.
Then she eventually she goes, I'm tired of these things. So she
Really,
took
no,
them off.
They actually started hurting me.
Yep.
Like right around when I graduated high school.
Yeah,
I
that's
noticed like
probably,
when I would come home from work, like it would like excruciating pain almost. And then I would take those
because her
off.
calves were getting
It-
more full.
yeah,
and
they were. Yeah, like the muscles were developing back into my legs. They got which was good, but it wasn't meant for those braces.
Yeah. But,
So I'm like, I'm gonna take these off. I'm not gonna wear these anymore.
well, and then she started out. She had orthotics, okay, made for her. The place would make them, but we always had to get them
Readjusted.
remade because they were never right.
Nope.
Eventually, she goes, "This
Screw that too.
sucks." She
I'm
said,
not doing
"You
that
know what?
either.
I'm not doing that anymore." She decided, I'm wearing regular shoes. I can put socks in the toe
That's what I do.
to kind of fill that.
Actually, now it's Target bags because
Oh, yeah,
those are a
Target
little more
bags.
comfortable.
a little
Yeah.
squishier.
Uh-huh.
Yeah. So she figured out how to do that. She's become very resilient. And I even sometimes when things are getting her down, I go, how are you going to let that beat you?
Yeah.
I mean, you went through a lot. Myself, I think I worry all the time
Yeah.
about her because
Yeah.
it was hard going through that. So she gets a cold. She starts coughing. I freak out. She goes, it's a cold. Okay. But so was the other one. Actually, the other one,
No,
like
that
how
one, I
she,
had no symptom
yeah,
really.
that's
It
the
just hit
problem.
me.
She said, oh,
Yeah.
my back hurts.
Mhm.
I don't feel good. She's really sick.
I was
She starts
tired.
coming back, and then she's in the hospital.
Yeah.
That's why I freak out, and she doesn't understand. You really didn't. I mean, it was like within 3 days, boom.
Yeah.
Just went so quick. You're like,
Yep.
how did
Mhm.
this happen?
Yep. So that's the thing. I mean, she's a tough person, and one of the things she always says is when they were talking about her removing her toes, she would say, She goes, I get to see my kids.
Yeah. That's I'm like I get to see my kid graduate, because he was just brand new in high school.
Yep.
I'm like I get to see him graduate.
So now we've seen all three of them.
Yep.
Christy
Just started college this year. Just finished her first year of
Yes.
college.
Yep.
Amazing.
So I think we think that you should do what you want to do, because that could have ended up so differently.
Yeah.
So
For
and I'm a crier.
Yep. That's what I learned.
Oh.
I'm the tough one.
It's okay.
Well, she didn't have to, but see, that's the thing. She didn't have to go through she was going
Right.
through
That's
it,
the
but
thing.
she was unaware.
Right.
And she didn't know, like, even her dad, when he went home after he saw her at the first hospital, he told his mom, or he told her mom, I don't know if we're bringing Stephanie home.
Mm-hmm.
Yeah.
Yeah, and
That's
that's
scary.
from his paramedic training. Like
Yeah,
he
it's
really,
Yep.
he recognized what was going on.
Well, now, definitely looking back on it, where I am as far as an attending, I can say there were some stars aligned in certain instances.
Oh yeah.
Oh, I believe
help
it.
you
definitely
recover
think so,
because you were incredibly ill, and
I was
if it were my patients, I would have had difficult
Well, and I was
conversations with you as
always
well.
Yeah.
Given
an
how sick
active-
she was.
an active teacher where I teach. I was always
Mhm.
involved with something that was going on at the school
Mhm.
with my own students and then with our own kids. So it just kind of worked out. Like the people that were taking care of me at the first hospital had siblings who knew that, they knew that I knew them. And so they're like, okay, well, we're going to do this, this, and this for her.
That's very
And then,
nice.
and then my own cousin, she herself is in, not so much anymore, but she was in respiratory, she's a respiratory therapist.
Mhm.
So she and her husband had a business in medical. And my other cousin actually worked on the dialysis machines.
Wow.
So yeah, we definitely think that there was a lot
of stars.
of
aligned.
extra going, like a lot of extra, what do they call that?
Serendipity.
Serendipity, kismet going on.
Yeah, for sure.
So
So if you had to leave people that are watching this with a final lesson about conquering an acute illness, or somewhat in your case, Uncle Chris, navigating the healthcare system, what did you take away from both being in the hospital and then recovery, and what last piece of advice could you leave to people?
So the first thing I'll say is probably preventative. Okay. I think, my opinion, it all started where she got influenza A. She did get
a flu shot
a flu shot.
in October.
And the nurse did tell her she thinks
Mhm.
maybe that's why she survived. Because at that time, 2012, 2013,
The
there were
flu was
people in their
horrible.
20s that were dying of the flu.
Yes.
So
Was that H1N1 year?
yes.
Yes.
I think so.
Yes, it
Yeah.
was.
Yeah.
And so
And that's I didn't have that though, did I?
no, you
I
had
had influenza A.
influenza A, I think. But I used to laugh at flu shots and things like that. Like flu shots. Now I'm like, no, we get a flu shot
We
every
make
year.
it a date now. We go get a flu shot together.
The other
Flu
thing I would
shot
say
and a
is,
drink.
when you're there, you need to ask. You need to ask questions. You need to ask for explanations. I'm a person that digs into stuff, so I didn't need total explanations, but I knew at least enough. Okay, here's the words they used. Go look
Mhm.
this stuff up. But if you don't know and you don't have those resources, or you don't even know how, I mean, some people can't find things. Ask, what's this mean? What do you mean? Like when they use the my silly concept of ARDS was, oh, it's just an inflammatory thing. They're going to give her anti-inflammatories, and they're going, no, that isn't how that works.
Yeah.
So I didn't know that, and the guy had to tell me. But I would have went home thinking, oh, they're going to give her ibuprofen or something like
Yeah.
that, and
Yeah.
I think it's to ask questions. You also have to, if they give you options about things, you have to think about what options you want, and you need to pick the options that are best for you, even if you're getting a lot of pushback, because we got a lot of pushback on the step down to
Yeah,
the
we did.
rehab. And I am glad that I pushed to get her into a hospital setting, because there was a doctor right there when she had that embolism,
Mhm.
which I think is better. Plus, they were doing physical therapy, I think, with you every day.
Mhm.
I think that's the thing I would say is you got to push for the knowledge, You got to push for what's best for the patient. That at the time I was her, the person.
Advocate.
Yeah, the person that
Mhm.
was given the consent. The person, she was still tired. Like when they were trying to make her go to to this other step down, I was the one that had the energy to say no, you're not doing that. You know, and it wasn't that I just didn't think that she needed something to push her. I didn't want her just sitting there,
Yeah.
you know. And maybe I'm just hard and saying, "Oh, she's tough." No, she is tough. You know, her recovery might have not went the way it did if I didn't push.
No, I don't
Um,
think it would have. I don't. I don't think it would have.
no, I don't either.
Yeah.
You know, I mean, I think you have to advocate for that person, and sometimes you don't have to be rude, but you have to make sure they understand. This is what I want for my wife. The other thing is, you know, you never talk about it too much, but the insurance stuff. Luckily, her insurance was fairly good.
Hmm.
Um, but a lot of the reasons why they're moving people is that insurance cuts off. They move this person, and I think that's, you know, one of the reasons she got finally released was not because of insurance reasons as much as you're in a place where there's diseases.
Yeah. That's what they
Yes,
told
that's
me.
that's a very common
We
thing.
want you to
Yep.
get out.
And
So
that
yeah.
was
and
yeah.
that was a scary thing bringing her home.
Because
So sometimes I have had these conversations. It's actually better for you to be home
Yep.
Mhm.
than staying in the hospital, even though you may feel more comfortable in a hospital setting because you're being monitored and
Yeah.
etc. Patients actually do better when they're at home because there's not as many illnesses spreading around. You're
Right.
at lower risk for hospital-acquired infections.
Yep.
And then there's just something about being home in your own environment,
Yep.
feeling more comfortable. The mind does do amazing things as far as helping motivate you and heal you and allow you to recover in a speedier fashion. I mean, it's panned out in a lot of studies that getting patients home when they're ready,
Right.
not we don't push patients out of the hospital to get them home. We
Yeah.
get them home when we're like, hey, you're ready. It may seem scary, but it's more beneficial at this point in time to get you
And
home
that's what they
than
told
to
me.
keep you here.
I
That's
think
exactly what they told me.
I think from that standpoint, I think that I was more worried about how she would do at home than she was, because I think, like you said, having the kids around you all the time,
Yeah. Well,
it's normal.
In One
It's-
Direction was really popular back
Oh.
then. So we would have One Direction. We would have One Direction half hour like every
and so
every
she was
night.
doing normal stuff,
Yeah.
stuff that she would have done before she was sick.
That's it,
Like her life was starting to get back to her new, what she calls
Her new normal.
Mhm.
Yeah.
Yeah, that is what I call it.
Yep.
And so what last words of advice would you leave people with who are either going through an illness or who are now recovering
the
from an
recovery,
illness
I mean,
and navigating the
The
healthcare
one thing with
system?
the recovery, I mean, my mom actually taught me this because in 1990 she went through something. She was actually hit by a car.
Oh.
So I mean, we compared notes a lot. So, but if you're going through recovery and you have to do physical therapy, don't skip it. Do it. I mean, the physical therapists are there to help you. And I'm just speaking from experience because there were some people there that were not doing themselves any favors and were frustrating the physical therapists because they just wouldn't
Do the
they wouldn't do
work.
and the one I mean I felt so bad. They weren't supposed to tell me this, but they were with that patient before me, so she was like,
You heard the gossip a
I'm
little
so
bit.
frustrated.
Yeah, you
But-
heard the
so,
frustration
yes.
coming from
So,
them.
and yes, I mean, take some Tylenol, ibuprofen, something before you go because it's gonna hurt, but it's worth it.
I think that's some of the challenging things we face as healthcare providers. And I know my wife is a physical therapy assistant will tell you too that they try to push you a lot. And I think some of the hardest things is just being honest with patients. Like, this isn't going to be comfortable,
Right.
but it's important. We wouldn't push you if we didn't know it worked.
Right.
We wouldn't push you if we didn't know it was going to help you get better. And I think it is frustrating when people don't want to do things. Now, I'm not saying there aren't reasons why people don't want to do things. It's when you're recovering. I've never been through it, but what I've heard, it's uncomfortable. It's painful.
it is
It can be
because-
miserable. It can get you down. But it is important. And I would love patients to realize too that, and I think that speaks to what you're saying about how the physical therapists were venting their frustration, because I think they're there to want to help.
They are.
And
Yeah.
when
I
we
mean,
see that we can't help, I think
Yeah.
it makes us
it's frustrating.
frustrated
Yes.
because we want to help. We want to have that story where someone was as sick as you,
Mhm.
they
You
got
succeed.
better, and we're like, I helped them get better.
Yeah.
Look at them now.
Right.
Some of the best stories are when I have taken care of with my colleagues people who've been literally a banana peel in next to the coffin and ready to slip
Yeah.
in,
Mhm.
and then literally 3 months later they walk into the ICU and they're like, "Thank you so much." Like
Mhm.
those
The-
are some of the best stories because you know that all your efforts were worth it.
Well, one of the things about the physical therapy part too is, yeah, the physical therapist can work with them and help them do those exercises, right? Teach them. But when they go home,
Oh yeah.
they
You
have to
gotta do it at home
continue.
too.
And I would make
Mhm.
her do it. So one of the funniest stories happened where she had got done with physical therapy. They were working on her hands. They would put her in like this corn silks
Oh, I
or
like that.
corn stuff. I
It was like a
forget.
machine, and
Yeah,
it was like corn husks
or something.
and it was warm. It
So
was nice. I liked
so
that.
she gets in. I get her in the car, and she had to put on a seatbelt. I said, "Well, put on your seatbelt." I can't do it. I can't do it because her hands are still like
Still
when we
pretty.
say her hands
They
were
were
like
still pretty
this.
stiff and
Yeah,
not
they were
able
stiff.
to move.
So she puts. She goes, "Ow! I hurt myself." And she goes, "Wait a second.
I can move
I
my
can
finger.
my finger." So I think that was the first time she gave me the finger after that.
The little victories of
But she
giving
goes,
your
"You hurt
husband
me."
the
I go,
finger.
"Look at your hand." She goes, "Oh." So whatever it was, because I wasn't trying to be mean, but I said she's got to learn to buckle her seatbelt.
Yeah.
I would have helped her, but then she goes, "Oh, you hurt me." I go, "I didn't do it." And then she goes, "Hey, wait a second." So I go,
I
Maybe you
like
should
that.
have buckled that seatbelt.
I think those
No, I'd rather have you be able to give me the finger than.
That's true. I think those words of advice for people navigating a difficult time are going
Oh,
to
it
be
is.
super useful and definitely encouraging.
Yeah,
I guess the last way I want to end too with you guys is knowing the position I am in now and the stories I've heard. Now, I can't answer everything, but as an ICU doctor, is there anything you'd want to ask me that you're still unclear about of what kind of may have happened or things you don't quite understand? Because sometimes there are things that are lost in translation, and I can't tell you I'm going to be completely 100% accurate, but I see a lot of this. And is there anything that you'd want to pick my brain about, whether it's from your acute illness or how the healthcare system works or any aspects of recovery and navigating the healthcare system itself?
Well, I didn't know um, that there's no bedside manner class. I mean,
Yeah.
it kind of makes sense. I was a teacher and nobody told me how to communicate with my students either. Like you said, it's all the technical part of teaching, the technical part of being a doctor. So yeah, I didn't know that.
So I think in
So
my medical school training, I think we had one lecture on like body language, like one, or like nonverbal communication. It was like an hour long.
yeah,
And communication can't be taught in an
no,
hour. It's
no,
impossible. We did have patient simulations where we had a patient interaction, but it was primarily focused on basically going through this checklist of questions you're supposed to ask and then doing these physical exam items and then developing your differential and what tests you're going to order and then next steps. But nowhere on there was, did you do these things while
right,
delivering bad news? Like a good example that I teach people is that when you're giving bad news, two of the best things you can do is get down on the patient's level instead of standing over them, because it makes the patient and their families feel like we're
Be
on
more
the same
comfortable.
team,
Right,
makes them feel more comfortable. It makes it feel like you're talking to someone rather than up
right,
at someone that's looking down on you. And so I teach my residents and nurse practitioners and PAs this all the time, is that put yourself on their level or even below them, if anything, because you want to empower the patients and their families to do that. And then sometimes when giving bad news or hard news, you can say, I don't have good news to give you to let people brace themselves. Because I find that when people are able to brace themselves, they take it a little better.
mm-hmm.
It's still difficult and still invokes a lot of emotion, but it definitely allows people to kind of brace themselves. And then I think also one of the things I also teach other people I'm training with is you need to learn how to read the room.
Right.
And sometimes you'll be able to tell what certain people grasp, what certain people don't, who needs more explanation, what needs more explanation. If you see like a puzzled look on somebody's face or someone looking up and they're trying to like work through something, like what's going on here. Sometimes you can ask, like, I see there's a little bit of confusion on your face. What a part of what I just told you is unclear, and how can I clarify that for you? And I think that's super important, and I think it's part of my mission a little bit to teach communication to the people I train and everybody out there, because I think it only helps. And I think teaching it in a way where we can deal with the chaos and how fast we have to work would
Yeah.
be very useful in medical school.
So one of the things that I would probably say is, even though I was told things, I was not sure of what their game plan was. You know, I knew what they were doing at that time, that moment. Oh, we're giving her this medication. We're doing this test, but I didn't. You know, and maybe I'm different than other people. I want to know what you're doing and the next step and the next step, depending on things. Because I'm pretty much like, okay, if I can't do this and that doesn't work, I'm going to do B.
Well, that's the engineer in you, I think.
But
Definitely.
but
Yeah.
but it would help people understand. Okay, they're going to do this. They're laying out a roadmap, kind of where they're going to go, and I think it would help those people to understand. Okay, here's the path, and eventually you're going to get to. Okay, I no longer have a branch to go. We've tried everything. That might be scary, but at least I would say, okay,
But I think
I could ask them, well, what happened here? What happened there?
just from my understanding too, just from like teaching, bringing and teaching this, I go in there every day having a lesson plan. Sometimes it goes the way I planned, sometimes it doesn't. So I can only imagine it's probably the same thing
Oh,
in
yeah.
medicine.
It's the same, but what I usually do for my patients is say, this is what I expect. These are what we're doing right now. This is what I'm hopeful for.
Okay.
But I'm not a crystal ball.
Yep.
I don't know what's going to happen on a day-to-day, so these things can change on a day-to-day basis.
And they could probably
But this is the
change.
basic plan for the next, let's say, 2 or 3 days. And I find that that's received a little bit better, because then it kind of gives you, like you're saying,
Mhm.
if let's say we do something one day, then when you're coming in the next day, you expect, and you won't be blindsided by if it's following the plan. You're like, oh, okay, this is exactly what they said.
Yeah.
Or if like the
I know what the
doctor or
next
nurse
step.
comes in and say, hey, some things have changed today, the plans have changed, it's not
Yeah.
the same as yesterday, then you're like, okay, they said it may
Yeah.
change day to day. It gives you a little bit of like, okay, they're trying to anticipate, but things happen.
Yep, and I did not really receive that.
Yeah.
I mean, I probably could have asked, and I could have said, well, and I did probably a couple times say, well, what's that mean? Where's this going? But they didn't lay it out for me, saying, hey, we're putting her on this, this, and this, and here's what we're going to do. Even when they put her on like that platelet medication or whatever it was, all I knew was it was to help her, I think, with her blood oxygen levels, maybe. I'm not sure, because I didn't ask that question. But I was just saying, okay, they're doing something,
But
why?
why?
What are they
Yeah.
expecting? And at the time, that was really very early on, and I was like, kind of stunned. I was like, how did she go from me going and calling her work to now I'm not talking to her, you know?
Yeah.
And I think the other thing is they do things in the hospital, like she had to get transported to another hospital to get some. You remember you had to go get transported from the rehab facility to another place.
For her toes? What was it
What
for?
was it for? Do you remember? And
I don't remember. I do remember going because it was hot
and
as
I think
blue blazes in the
I
back
think
of
I
that
talked
ambulance.
to the
My mom went with me.
podiatrist.
Yeah, mom, because mom
I
went with me on that. I don't
I
remember what
talked to
was
the
going on that day.
podiatrist about it in the rehab hospital.
Yeah.
He actually that's one of the hospitals that he worked at. So I did talk to him there. So it was some other thing where they had to transfer, and I wonder, why do they do those things? Why can't they just do whatever they're going to do at that because it was a regular hospital.
Yeah.
So
I think sometimes certain hospitals are limited in their capabilities. It was probably like a test they couldn't do, a procedure they couldn't do at that particular facility. I think a lot of misconceptions about hospitals is the way a lot of hospital systems are now is you have a main hub that's what's called your tertiary or quaternary care center that can literally do everything.
okay.
And then you have these satellite community hospitals. Some satellite community hospitals can do a lot, and
Yeah.
even some of them specialize in certain things. Like a good example, when I was training in New York, we had this one hospital that they were known for orthopedics. So like
Okay.
complex orthopedics instead of going to the tertiary quaternary care center hospital, if it was just an orthopedic problem primarily, they would just go there because they specialized, like really specialized, even though the other big hospital, main hospital could do it. They went to that specialized hospital because it helps not only offload the main one that's getting a ton of patients from other hospitals, but they also have an in-depth focus at that
Okay.
hospital that sometimes they're like the go-tos in the system for that. So it just depends on the capabilities and resources of that
Okay.
hospital.
I do remember.
That's why some
You do remember
patients
that
get
I do. I forget
transported
what- I
back and
forget
forth, but
what.
it's very complex, and I don't think we do patients and their families justice in explaining that. It's not that we can't take care of you here.
Yeah.
It's just that certain things we don't have here, and it's
Yeah.
in the best interest to send you to a place that does have
It
it.
was for a test, but I forget what it was now.
Yeah.
Yeah.
And that
Yeah.
and that does it because I look at her and she was still not well. I'm like, you're transporting her someplace, and it just happened to be funny because that back of that ambulance or squad was 1,000,000 degrees.
So hot.
They were so hot.
Oh my
She goes, I'm
gosh.
getting sick in here just from
Yes.
running.
It was so
But
hot.
Sweat bubba.
but yeah, and things are big organizations, and the interactions between them are very complex a lot of times.
Mhm.
But the normal person doesn't understand that.
No.
If you're just a normal person and you're working in a grocery store,
Yeah.
you don't understand those
Mhm.
complexities between these
No.
big giant organizations.
Absolutely not.
So
Yeah.
and I even though I work for a big company and I know that we do this here and we do that there. When I'm talking about my wife's health, I'm thinking you do everything here,
Yeah.
and it doesn't work like that.
Yeah.
No.
Yeah.
So
Yeah. That's very true. I mean, it's nowadays it's very difficult to navigate the healthcare system. I think that's another reason why I like talking to people like you guys, because it brings a real human element of what's going on and how people can help navigate the complexities of the healthcare system and even somewhat what to expect. I mean, from what they did transferring her from the smaller hospital to the main tertiary quaternary care center, where she got higher levels of care, even if it's increased monitoring or other potential interventions that she could have had. I don't think people understand that sometimes. Like you said, I go to my local community hospital. Sometimes you think you're just going to stay there and they have everything you need, but it's not always the case.
yep.
And the providers know that. And I think just the lay people, I think as providers, we need to do a better job of communicating. This is what we can do. We're hopeful that you would just stay here until you go home. But if you need something that is absolutely necessary, we talk to other hospitals to get you where
Mhm.
you need to go. Because that's our primary focus. Our primary focus is getting you in the place that gives you the best chance of recovery. That is 100% our focus at any place a patient goes. And if we don't have resources, we send you to a place where they can potentially do the things we can't do. But you're right. The average person doesn't know that about hospitals. And I think it's one of the things that would help in advocating too. And I think to your point, asking questions like, oh, they say they're going to do this here. Well, can you do this here? Or if someone were to ask, oh, is there any other things we can do? Sometimes even advocating, well, can you reach out to your quaternary or tertiary care center hospital if it's indicated, if they may be able to offer other resources, can be a way you can advocate for your loved one. Now, sometimes the answer is no, they can do everything at that hospital that the other main hospital can do, and they don't go. But I think it's important to at least ask. And I think that'd be super helpful for patients. And I agree with you advocating for yourself as a patient when you're able to and recovering, and then advocating for your loved ones is something that's super important. So, is there any last thoughts you guys like to share with everybody before we stop? That I know this has been super enjoyable to me, and I know it's difficult. I had a conversation with my parents, and they actually really enjoyed talking about my dad's recovery through cancer because they'd never been given the opportunity to have a sit down with somebody and just kind of unload all the
Yeah.
details of
Oh,
what
Right.
went on, and it can be immense and it can build up on you over time if you don't address it. And I think it's something I enjoy talking about this type of stuff. I have a different perspective I can give you guys, and you have a different perspective
Mhm.
you can
Yeah.
give me, because I didn't live through it.
Right.
I didn't live through the difficulties of it. You guys lived through it gracefully.
Yeah. Well, I
would
would say that I've probably told Stephanie's story 1,000,000 times to different people because when people look at her,
They
they
don't
don't
know.
they don't see anything.
Mm-mm.
And I go, You have no idea.
Yeah.
So,
I just told a lady that I work with because she asked me what my plans are for the Memorial Day weekend, and I said, "Well, my husband and I are gonna be on a podcast tomorrow." And she goes, "What? For what?" And I'm like, "Oh, well, you probably don't know because weren't working here." So I told her, and I actually had her son in 8th grade this year, and she goes, "I had no idea." She goes, "Did you tell the kids?" I'm like, "Well, I tell them some of it, yeah, because sometimes I get up and I
Well,
can't walk
if your
exactly straight
students
at that
want to
moment,
know
but
and they want to increase their medical knowledge and
right."
understanding of healthcare, please feel free
Well,
to
okay, I'll tell
share their website with my website with
Yes.
them and the podcast channel on YouTube that I'm going to be
I know, 'cause
sending you
that's what
guys
they're
once I
watching all
edit
the
the
time.
episode and everything. I think that would be super fun, and part of my goal is to reach people. I mean, if I could reach younger people so they can understand the healthcare system earlier, that would be wonderful.
oh,
So
yeah.
they could help their loved ones kind of navigate it. That's one of my primary goals. I would love to be able to do that
Yeah,
for
because
people.
I don't think people do know. I mean, I was lucky because, well, both my parents, eventually my mom worked for a dentist
Mhm.
once my brother and I entered college. That's how she paid for our college. So yeah, I don't think people do know. And my mom actually taught me what I know about insurance and
Yeah.
Yeah. And your dad
Yeah,
knew from your dad's experience as a
yeah.
paramedic,
Yep.
taught you a little more about medicine. But you're
Yep.
right, not a lot of people
people don't
have
know
that luck and those
Mm-mm.
people in their lives.
Our kids don't really know. I can
No, I
tell
don't
you
think
that, even
so.
though she went through that, they were young at the time. They don't understand because none of them, like I said, we've been fortunate.
Yeah.
There's been
Yeah.
no real big medical problems that they've had to be part of.
Yeah.
They're young. They think they're invincible. They, I don't even think they really understand that. Okay, insurance is nice, and yeah, it'll give you, some off of your glasses and this, that, and the other. But when you have a big problem, how do you get things? Because it's overwhelming.
Yeah.
It is overwhelming when people are pushing forms in front of you. Oh, you got to sign this consent form.
Yep.
Oh, I don't know how many I signed for her.
We could have bought a
Okay.
new card.
Yeah, or they could have, because I didn't care, but it is, everybody says, oh, you need to read everything. Oh, let's face it,
You don't
you
have
read those
time in that,
forms.
no.
First, it's
Some
you
of
know,
them are
It's-
like 4 pages long.
Yep,
And you're
Right.
like, I
and
can't
some of
read
the
It's in
words,
very
it's
medical
very
terms.
or legalese,
Yeah.
and
Yeah.
people don't understand. I think I would just be confident that I do think that the places are trying to help you.
Yeah.
Okay. And yeah, it's overwhelming, but you have to understand, one, they're protecting themselves too.
Yeah.
I mean, everybody's, sue happy sometimes, but I don't think that they're doing those things to hurt the person. Okay. But they got to also make sure that they're covering their own selves too. And I have to say, I mean, I think everybody that I encountered, yeah, for different personalities and that, with what she was going through, um, you have the good people that make you feel comfortable.
Mhm.
She had many nurses that made her feel good.
Mhm.
Yeah.
You have the people that kind of get under your nerves a little bit,
Yeah.
Looking
and
at
then you have
sneaks.
the people that are just by the book.
Yeah.
They are detached from feeling,
Mhm.
and they're just numbers persons. Yep, this.
Well,
I check these things.
that might be a defense mechanism on their part
Yeah.
Well, it
because
could
they
be.
Yeah.
see so much.
So much.
Exactly,
Yeah.
but I think most of them want to do the right thing.
Yeah.
You know.
I agree with you. I think I would say most of our burnout in our profession right now is not due to us wanting to do the right thing, and we have the patient's best interest in mind. I think it's a lot of other things that, in some instances, whether it's we see sick patients all the time and we're so detached, or we're so overwhelmed with all the administrative burdens and documentation and other parts of our field that have made us more detached, so that we don't burden ourselves with that emotional stress as we see patients. I think that a vast majority, I would say 98, 99% of the people who are in healthcare right now, they want to see the patients do well. They're trying to do things the best they can. Doesn't mean we don't make mistakes. We are human beings. But I don't think that a vast majority of us do things in any way to try to harm someone.
No.
So I agree with you. I think it's important to recognize, and there is some elements, like you said, of trust when it comes to signing consent forms, and they're 4 pages long. And I think that's where it comes on us as healthcare providers to explain these things in layman's terms, these giant forms of like what this means
Yeah.
and what you're expected to understand about the risks and the benefits of these things going forward. And I think that's super important for people to understand. And I think you guys telling your story about what Aunt Stephanie went through and you guys went through as a family is kind of one of those other steps in the right direction. And I really appreciate you guys coming on and taking your Saturday afternoon and coming out and talking and kind of unpacking things that's a little emotional and personal too. Definitely not easy. Fun, probably, because I know you like to talk, Uncle Chris and Aunt Stephanie.
Yeah.
But still challenging to unpack and definitely invokes a lot of emotions that you may have to go through again. If you enjoyed the content of this episode, you can access more content and courses just like it on our website. Please visit mededempire.com for more free content and information. Until next time, remember, the foundation for better care and your healthcare confidence starts here.